Bismillahirrahmanirrahim. Assalamu alaikum. My dear students, we are here with the second part of our lecture, which was analgesics, which we started yesterday. And analgesics, we broadly classified them into non-steroidal anti-inflammatory drugs and the opioid analgesics. The main prototype drug is morphine. So let's see what we have got for the next slide. Yes, as you can see, there is in the slide there is display of the Greek mythology god, which is the god of sleep and dreams called Morpheus. Another picture depicting the famous fictional character Morpheus from the movie Matrix. So the word morphine is basically derived from Morpheus, and we are going to study about morphine, which is the main drug, and we'll be discussing other opioid analgesics and their antagonists. So in the next slide will be about the learning objectives. By the end of this chapter, you should be able to identify opioid receptor subtypes and their mechanisms, opioid agonist in terms of their analgesic efficacy and their characteristics. This is a very important question from the examination point of view. You are asked about name the location of various opioid receptors, which are of three types. We are going to study mu, kappa, and delta, and then you should know okay, what is their location, what is their pharmacological actions. So another checklist point is describe the cardinal signs in treatment of opioid drug overdose and of the withdrawal symptoms. Very important. If you know okay, opioid analgesics are causing this toxicity, so how do you want to treat it? We'll be discussing various scenarios as well. Then you should know the adverse and effects of the opioid analgesics, both acute and chronic. You should be able to identify opioid receptor antagonists, which are pure as well as which are mixed. Then you should be knowing that various opioid analgesics, they have also other effects other than causing analgesia, like as it is mentioned, antitussive effect and for antidiarrheal effect. So this is a very beautiful scenic view of the poppy flowers. Okay, here we are with the poppy capsule, and the crude opium is obtained from the opium poppy, Papaver somniferous plant. There is another picture showing the, as you can see, there is the exudate which is coming out from the poppy capsule and which is the unripe form, and which when dried becomes brown, and it's called crude opium. There are two types of opium alkaloids or active principles. Phenanthrene comprising of 10% morphine and benzoisoquinolones comprising of 6%. Opioid analgesics, the main drug is morphine, and it's a standard analgesic and relieves severe pain with remarkable effect. In our body, there are various endogenous peptides as well, or neurotransmitters like enkephalins and endorphins, which are produced by our own body to fight the pain. So endogenous peptides are basically neurotransmitters produced by the body to fight pain. They bind to peptide sites, opioid receptors. And we have got three families like endorphins, comprising of endorphin 1 and 2, enkephalins, metenkephalin, endoenkephalin, and dynorphins. They are released from the body during painful conditions, and they have a high affinity to mu receptors and modulate the pain. So this is the list of opioid receptors. Basically, there are three types of opioids, mu, kappa, and delta. A very important university question. As I already told you, tell the location and functions of various opioid receptors. So they have got a depressant effects as well as stimulant effects. So depressant effect, it causes analgesia. What is it doing? It is relieving the pain. Supraspinal, spinal, and peripheral. So as you can see that mu receptors are affecting all the types of analgesia at various levels. Whereas kappa and delta receptors, they have negligible effect on the supraspinal analgesia. Similarly, on respiratory depression, mu receptor is having a very marked respiratory depression. Sedation, mu and delta both cause sedative effects. And similarly, the more marked effect of euphoria is seen with mu receptors, and dysphoria is seen with delta receptors. So this is a very important difference between the mu and delta, that delta receptor is causing dysphoria instead of euphoria. Then physical dependence. The more the physical dependence is seen with opioid, which have more affinity for mu receptors. Now if we move on to other effects like stimulant effect. The previous effects were depressant effects, and the next one are stimulant effect. They cause meiosis, which is the pupillary constriction through mu receptors. And there is effects on the increased skeletal muscles and GIT. Skeletal muscles and GIT, mu, kappa and delta, both are affecting, all of them are rather affecting the tone. And opioids may act as agonist, partial agonist, or antagonist. Or any opioid may act on all the types of receptors or only on one type of receptor, and the action of that drug depends upon the affinity for its receptor as well.